Hi everyone, I am Dr. S. Mutukani. I am working as a consultant neurologist and epileptologist at Apollo Hospitals, Green Road, Chennai. Today I am going to discuss about epilepsy. What is epilepsy? Epilepsy is a brain disorder in which patient gets repeated seizures. For example, when a patient gets more than 2 seizures 24 hours apart, that is what we call them as epilepsy. What actually produces epilepsy? See, there are various reasons for epilepsy and depends upon the age of the patient. For example, if you take a child with epilepsy, the most common reason in India is being called hypoxic ischemic encephalopathy. That is because of the perinatal insult to the brain. And there are some various congenital malformations in the brain which can also produce epilepsy, or sometimes an accident which produces some scars in the brain that can also produce epilepsy. What are the common reasons for epilepsy? The main reason would be, for example, a brain tumor which is producing epilepsy, or a person who gets stroke and following the stroke there will be a scar in the brain which can also produce epilepsy. And in old aged people, because of dementia or loss of memory or brain atrophy, that can also sometimes produce epilepsy. What is epilepsy surgery? So many people may fear about epilepsy surgery. So don't worry about all these epilepsy surgeries. We have procedure called long-term video EEG. So here we admit the patient for 3 days, then we will record the seizures through which we are able to say the seizure where it is actually starting from in which part of the brain. So for example, the seizures are starting from right side of the brain in a region called right temporal lobe. Then we will do a high quality dedicated epilepsy protocol MRI to find out is there any structural abnormality in that region. For example, there is a scar in the right temporal region, the same side. So the video EEG and MRI both are correlating. So here we will proceed straight away to the epilepsy surgery, where we will go and remove a small part of the brain which is producing the seizure. So we will not remove a bigger part of the brain through which you are going to get some problems and all. No, we will remove only a small part of the brain, and usually that part will not have any specific functions. So the patient will not lose any functions after the epilepsy surgery, and the epilepsy also will get completely cured.